October 19th. The County Commissioners meeting will now please come to order. And please stand with us as we honor God and country with a prayer and then with the Pledge of Allegiance. Let's bow our heads, please. Gracious Heavenly Father, once again, we invoke your presence into our gathering. We ask that your hand be upon the decisions that we make and that we make the best decision possible for our community and for its citizens. We ask this thing in your precious name. Amen. Amen. Join me in the pledge, please. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. I got it.
All right, let's get to the good stuff. You know, you can tell a lot about a group of people by what they celebrate, and tonight we have a couple of celebrations to make. We have our own Jimmy Keefe, who has formerly been the liaison to the fire service, and he's almost continued that role as a de facto liaison, but he is close to that group. And so our first award tonight, if I'll ask Jimmy to come down, please. Will social distance, even though we brought masks, we forgot them. But Commissioner Jimmy Keefe was honored during the 2020 Valor Awards ceremony hosted by the Greater Fayetteville Chamber of Commerce on October 13th at Manna Church. The Valor Awards have been presented annually by the Greater Fayetteville Chamber to show appreciation to first responders and other public safety officials throughout Cumberland County for their service to the community. Commissioner Keefe received the Award of Merit for his work while serving as the Cumberland County Fire Commissioner and for his participation on the county's Public Safety Task Force. The Award of Merit recognizes outstanding public safety work that demonstrates initiative, ingenuity, and diligence. The Public Safety Task Force has brought forth a revised funding model for the service in Cumberland County that was eventually approved by the Board of Commissioners. At this time, we'd like to congratulate Commissioner Keefe and thank you for your service. And the mic is yours.
Thank you, Mr. Chairman. You know, one of the things we all do when we get elected is we want to make our community a better place. And by being involved with law enforcement, first responders, you know, there is a calling for them, just like there's a calling for somebody in the military or the church or even politics. Sometimes there's a calling. But this was just an idea that manifested itself. There have been so many things that this Board of Commissioners have done in support of public safety. One of the things I want to talk about really quick is up until this past year, the contracts and the certifications and everything, now there's a standardized grouping of all of these things for whenever a first responder comes to your house. They're trained in such a way that you'll get the best service possible. I do need to talk about a few things. I've got to thank the county manager. She has been wonderful throughout this because she has been very supportive. Dr. Keene at FTCC has always been wonderful with us. But most of all, I just happened to be the person that got the award. It would have never gone anywhere without the rest of the Board of Commissioners in support of that also. This community is very important to all of us. Personally for me, and most of my commissioners know that I spend many nights, sleepless nights, dreaming of a better community and how we can make this a better place. And again, I want to thank all the commissioners who were a big part of that because it would have never gone anywhere without their support. Thank you.
Thank you, Commissioner Keefe. It's an honor well deserved, I assure you that. The next recognition that we have is Dr. Jennifer Green. If you'll step up here with me, please. Now, here's a person none of us knew a year ago. In fact, she came to work almost a year ago here. But during the Valor Awards on October 13th, the Greater Fayetteville Chamber also recognized Public Health Director Dr. Jennifer Green for service to the community in the battle against the coronavirus. Dr. Green moved to Cumberland County from Kansas not quite a year ago to become our Public Health Director. She hit the ground running and has not slowed down in leading the health department's response to COVID-19. We have a much deeper appreciation for the role that public health plays in our community, and we are grateful to Dr. Green and her staff for what they're doing every day. Dr. Green, we salute you, we congratulate you, and we thank you for your service. It's been just exemplary, and at one time you were the most popular woman in Cumberland County. I don't think you knew that, but you're not as popular as you were, but wait, if this thing kicks up again, she'll be right back on top. But the mic is yours for a few words.
Well, I want to thank the team, especially our team at the health department. Everyone sees my face all the time, and as the most popular woman in Cumberland County, but it is really our team at the health department that does this work every day. Our contact tracers, our epidemiology staff, our nurses, our management support staff, our facility staff. I'm getting myself in trouble because I started naming people, but we have an excellent team that I sent them an email on Friday that said, you know, they not just jog, but run literally alongside of me on some days, and it is this is theirs, and this is the work that they do. And for the rest of the county employees, from our IT staff to our staff and PIO that keep us on our toes. So it's really an effort that we can't, and I'm thinking more people, our DSS staff, our library staff, that are really doing this work right alongside with us. And it's really for the community as well, because we can't do this alone. This is the work of our community. So thank you.
Thank you, Dr. Green. Again, we salute you so much. And now we proceed to our public comment period, and I'd like to ask County Manager to read our rules for comment.
Yes, sir. Thank you, Mr. Chairman. As you know, this is an opportunity for the board to hear the concerns of our citizens in Cumberland County. We have 15 minutes allotted for the public comment period. Each speaker will be limited to a maximum time of 3 minutes. We ask each speaker as they approach the lectern to please give us their name and their address. Thank you, Mr. Chairman.
Okay, this time I'll open the public comment period. I'll ask the clerk if we have any speakers tonight.
Good evening. This evening we have 4 speakers. Our first speaker is Ms. Kathy Greggs.
Okay. Welcome, Kathy Greggs.
Can you hear me? I'll take it off.
There you
Hello.
go. Better.
Good evening. My name is Kathy Greggs. I'm the co-founder and president of Fayetteville Police Accountability Community Task Force. I come to you this evening regarding the mental health response for our police department. As you know, John Hare was recently killed by a Cumberland County Sheriff Department several days ago. Also, Adrian Roberts was also killed by our Cumberland County Sheriff Department. I sent a binding contract that I feel the county should have for mental health response. My response back from the chairman, Fairclough, was very, very, very disturbing, because we're telling the county, from the county, telling the city they should do it, but yet no one's having a solution to the problem. The solution is you have $15 million that you inputted in the county detention center for mental health, but you don't have that for the county itself. So our question is, what are we going to do about the police responding to mental health? People are dying in the streets. I don't understand why we have a crisis intervention team certified through the county sheriff department, but they're not responding. We have county sheriff deputies responding, but not the person that's certified. I have a problem with that. And all you should take leadership and responsibility to do that. I was in the United States Army. I was a combat veteran. I served my country. My parents served this country. My parents live here in this county. as leaders, you must take responsibility for your actions, and you must make sure the citizens get what they're supposed to get from you, because you get paid from us. We don't get paid from you. You need to do your job. Thank you.
Our next speaker is Miss Allison Smotherman.
Hi,
Hi.
can you hear me? My name is Allison Smotherman. My address is 630 Connolly Drive, Hope Mills, North Carolina. First, I would like to thank each of you for allowing me to speak on today. I ask each of you to take a moment and think of someone very special in your life. Imagine you are working and 3 undercover police officers come to your workplace and knock at your office door. Imagine the officers telling you that your loved one had been shot and killed at the hands of a police officer. Imagine hearing the entire incident was recorded and posted on Facebook. Imagine trying to build up your strength to watch the video that everyone is talking about. Imagine hearing your loved one crying and being remorseful of what he did by saying that he was sorry several times and that he didn't want to die, just begging for his life. Imagine finding out that the police officer that shot your loved one at the command of a nurse is still employed with the Fayetteville Police Department. Imagine hearing a nurse yelling to the other nurses, "Don't care about him, don't care about him, care for the police." Imagine the hurt and pain that you would feel knowing that your loved one bled out on the floor without anyone being by his side or helping him. November 6th will make a year that my nephew, Trevor Smotherman, was shot and killed by a Fayetteville police officer at Cape Fear Valley Medical Center. Yet we have not been shown any transparency from Fayetteville law enforcement, Cape Fear Valley Medical Center, or Sheriff's Office. It is evident that change is needed here in Fayetteville. It is time for the police to be held accountable for their misconduct. Qualified immunity as well as internal investigations has covered up too many guilty police officers. Since my nephew's untimely death, there have been 2 other men by the name of Adrian Roberts and John Hare who were shot and killed by law enforcement. The 2 suffered mental health issues as well. Their families called law enforcement for help and informed them in advance that their loved one was mentally ill. It is evident that our law enforcement is not equipped to handle people with mental health issues. In fact, I believe that a city should agree to implement new positions in law enforcement, such as crisis intervention specialists. This team of professionals would include counselors, clinical social workers, as well as psychologists. These highly qualified professionals would assist law enforcement by assessing the needs of the mentally ill by communicating with their families and loved ones and using their skills to de-escalate situations alongside of law enforcement. When families reach out to law enforcement for transparency, ignoring them should never be an option. These qualified professionals are equipped to show empathy and compassion when communicating with families on behalf of law enforcement. This effort will help bridge the gap with law enforcement and the community. It is understood that it takes an entire community to make change by voting, as well as voicing our concerns to our city councilors, commissioners, and legislators. Ultimately, change needs to start right here in Cumberland County. Thank you again for having me.
Thank you. Thank you.
Our third speaker this evening is Jeffrey Harley. Is Mr. Harley present?
Go on to your next speaker.
Our fourth and last speaker this evening is Mr. Sean McMillan.
All right, good evening.
Good evening.
Less than 2 weeks ago on a Thursday morning, Cumberland County awakened to the news that another person had been killed by the Cumberland County Sheriff's Office deputies. If this was just a one-off or an anomaly, we wouldn't be here to speak to you today. Unfortunately, at least 3 people have been killed by local law enforcement since PAC last addressed the Board of Commissioners back in August. Adrian Roberts was killed on 19th August, Glenn Eldridge was killed on September 10th, and a man who died less than 2 weeks ago is John Hare. We add John Hare to the list of people killed by law enforcement here in the county. That includes Najee Hagans, Kevin Grissett, Lawrence Graham, Shakur McNair, Trevor Smotherman, and Joshua Oxendine. PACT has been asking for specialized response for mental health crisis intervention since September 2010 police shooting of Timothy Smith Jr. Mr. Smith was shot several times by CCSO and then left to bleed out on the ground for over 20 minutes before aid was rendered. This is on video. Amazingly, Timothy Smith Jr. survived being shot by deputies. However, he would still be in prison today if his mother had not requested video footage which proved that he did not fire at the deputies. The deputy falsified the report. He left the CCSO shortly after the shooting. For every Timothy Smith Jr., there could be dozens more in our county that fall victim to false reporting and unchecked police misconduct. 2 years later, we also have a system that routes the allegations of police misconduct right back to the police. The Civilian Police Oversight Authority, in conjunction with the CRB, is a proposed answer to this problem. We request a special meeting of the Cumberland County Board of Commissioners to discuss this as an option, as well as non-binding resolutions stating the need for independent oversight of the police, and a non-binding resolution stating the need for body cams on Sheriff's Office deputies. Please stop misleading the public with statements that oversight of the Sheriff's Office is not in your purview. It is, and you are the only elected body in our county that could establish this with any degree of independence. The CCSO has failed to make a single major policy change since the uprising that followed the death of George Floyd, not one. Police kneeling, painting, recruitment pitches, and performative dance changes, nothing. We need your help in reforming policies and enacting substantive structural change. That's what we will continue to demand. We need independent oversight now. Thank you for your time.
Thank you.
Okay, there are no more speakers. Thank you so much for your comments. We'll close the public comment period now. Ask the county manager for approval of the agenda.
We have no changes this evening.
No changes. Do I hear a motion?
Second.
Moved and seconded. Any discussion? All in favor?
Unanimous.
Item number 2 is a presentation. Commissioners, this evening, we have asked Dr. Jennifer Green to give us a COVID-19 and an influenza update. At the end of her presentation, we do have a request. We request that you consider approval of the influenza rate increase. So I asked Dr. Green to come forward at this time and give us her presentation.
Welcome again, Dr. Green.
Good afternoon. All right, good evening, Commissioners. We'll start with the COVID-19 update for our community. This graph is from the North Carolina Department of Health and Human Services, and this shows our case positive, or our number of positive cases since the pandemic started in March. And so the yellow line is the line where you want to draw your attention. It shows the trend line for COVID-19 cases in Cumberland County. In particular, you can see that over the last week or so, we've seen, or last 7 to 10 days, we've seen an increase in cases of COVID-19 in our community. This is not the total number of cases. This is, I pulled this data down on Sunday evening, so as of today, we have more than 6,500 cases. So you can see that, of course, the numbers are going to continue to tick up. So this is, we're monitoring the data closely, but this is concerning to us. We haven't seen a consistent downward trend for quite a while. We'll have a week or two of decrease and then followed by an increase. So we have not seen a sustained decrease of cases yet. This data shows our cases by race, ethnicity, and age, and as we've had nationally and both in Cumberland County and statewide, the pandemic, of course, is disproportionately impacting African Americans and disproportionately impacting our our young adults between the ages of 25 to 49 are where the most of our cases lie. And then when we look at the death data, we'll see a different picture. The State Health Department on Friday added some new data points to their website that I want to draw your attention to. You can see the cases by now at the county level, the number of cases in the last 7 days, the number of cases in the last 14 days, and then you can also see, oh, sorry, thank you. You can also see the daily cases per 1,000 or 100,000. So I'm going to walk through these, and this is important because it kind of gives you the picture of what's happening now in Cumberland County, and then you can compare us to other counties. So in the last 7 days, we've had 380 cases. In the last 14 days, we've had 709 cases. So if you do the math and the difference between the last 14 days and the last 7 days, there's a difference there, and our number of cases is increasing more rapidly than it was several weeks ago. We also want to look at our daily average of cases. So this number comes from the Harvard Institute for Global Public Health, and on average, we have an estimated number of 56 cases a day, and that's a 7-day moving average. So that's far too many cases, and if I go back one slide, you can see that it doesn't feel so bad now, but back in March, April, May, even in early June, we saw a pretty steady leveling of cases, and then we increased in July, and then we never came back down from there. We decreased a bit, but we didn't come back down to our April or even June levels. So I'd like to see those numbers come down. Our daily average of cases is still too high. That's increased from a week ago. A week ago, we probably had a daily average of cases of around 40. The other number we want to look at is our daily cases per population size. So this really levels out the cases by county. We have a similar denominator across all of the counties, and so you can see this makes for a better comparison county by county. So on average, we have 16.7 cases per 100,000 population. We'd like to see that number below 10. That will get us out of the orange zone. So we'd like to see that number come down. We get a lot of questions about the case positivity rate. So the case positivity rate is the percentage of tests that come back positive out of all the tests that we do in Cumberland County. And by we, I don't mean just the health department, I mean all of our healthcare providers in the county. So right now, when I pull down the data today, we have a case positivity rate of 6.0%. The World Health Organization target is 5%. So this number has been coming down over the last several weeks, but we're not at the target yet. This number is also reflective of the amount of testing that we're doing in our community. So one way to bring this number down is to do more testing. The state health department has set a target for us, for every county, to test 5% of the population every 30 days. So that equates to almost 17,000 tests a month or 4,200 tests a week. So the graph on the right side of the screen shows the number of tests that we do week by week by week. So, and again, by we, I mean county-wide. And so the last couple of weeks, we've hit closer to 5,000 tests a week. And so that's good. We are getting closer to, we have met our target to test about 4,200 individuals a week, but we still like to see more testing available. In particular, free testing sites is what we'd like to see more of. And the state health department has some testing initiatives that will bring more free testing to Cumberland County. So we're collaborating with our community health centers and the state health department on those initiatives. I want to point your attention next to some recovery data. So we get a lot of questions about recovery data, and for a lot of data cleaning reasons, it's really challenging to calculate this data in a way that is accurate, but we think that we've been able to do this. So our recovery data shows our active number of cases, the number of individuals that have deceased, and the number of individuals that have recovered. And when we say recovered, we mean presumed to be recovered, and that is an estimation. And we use the state health department's definition of recovery for this. So we count 14 days from the date the individual has been tested. And if they were hospitalized, we count 28 days from the day they were tested, or if we don't know their hospitalization status. So we gather all of that data, and one of the reasons it's challenging is because we have to know if somebody's been hospitalized or not, and people, of course, can get hospitalized in any location, even if they're a Cumberland County resident. So currently, we have 97 individuals that have been deceased. We have 574 active cases and 5,721 cases that we presume to be recovered as of last Friday. So we pull this down, because it's time intensive to calculate the data, we pull this down once a week. In terms of death, this is a different picture than what we see for our cases. 82% of our deaths have been among those that are over the age of 65. Most have been male, most are African American, most have been hospitalized, but not all. Most had some comorbidity, 88%, and 51% have been in a congregate living setting. So I think we all think about our loved ones that are passing away in long-term care facilities, and that's true, but it's not all of our deaths. We've had many that are outside of long-term care facilities also pass away. I want to talk about two initiatives that are new since I believe the last time we've done a presentation. And one is our regional prevention support team. So we just talked about long-term care facilities. They continue to be a challenge. We have several with outbreaks in our community. The state has launched an initiative to help support long-term care facilities in each of the 10 public health regions. So with funding from the North Carolina Department of Health and Human Services, these regional prevention support teams will work with long-term care facilities on prevention, not just for COVID, but for any communicable or infectious disease, really, and to provide on-site infection prevention, control, and training for staff, and to help consult with these long-term care facilities. So we just hired 3 individuals to be a part of that team. The Cumberland County is the fiscal agent for this grant, although it supports counties in our region. And these individuals are actually housed in Moore County. But we communicate with them on a daily basis. So the overall goal is to reduce the introduction of disease into the facility, and they have a very evidence-based approach to working with facilities and making sure that they're that technical assistance piece. And this is really helpful because we get long-term care facilities frequently that have questions that we can't always have the time or the capacity to answer for them. So this provides them that one-on-one level of support. So last week we kicked off, and we have 1 coordinator position that we hired, and we have capacity to hire 3 trainers to support that coordinator, and we've hired 2 of them, and we have 1 more position vacant that we will have hired for that. So we're excited that they're here and ready to get rolling. We have a great and experienced team that will help support the region. The next piece I want to update you about is our COVID-19 vaccine. So this, of course, has been all over the news, and want to share a little bit about what we're doing in preparation. So on Friday, the State Health Department submitted their state vaccination plan to the CDC, and it outlined, and it's a public document, and it outlines their approach for vaccinating our public. In addition, today, we submitted our vaccination provider agreement to the State Health Department. So we are not required to have our own vaccination plan, although the health department has what we call a mass vax plan. We have a mass vaccination plan that we already have pre-COVID that we maintain as part of our emergency operation procedures. So that plan will help guide our work for implementing the COVID-19 vaccine should it become available. The state has prioritized phase 1, and phase 1 is really focusing on critical infrastructure or critical healthcare workers, our essential workers, specifically our emergency management, fire, and first responders, our long-term care facility staff and residents, and those that are living in congregate settings, farm workers, migrant farm workers, those that are homeless, those that are incarcerated, and then those that live and work, or those workers that are in high-density occupations. So you might work in a food processing plant. Even with all of those numbers, we know that we're going to have to break down phase 1 into phase 1A, phase 1B, because that's when we run the numbers, there's still too many people to vaccinate with the first phase of doses. So we are working on our plan and collaborating with emergency management in the hospital and waiting for additional guidance from the state about what this will look like and how this will roll out. So we get COVID-19 vaccination updates during our calls with the state health department, and we're just in the planning stages now to make sure that we have the supplies that we need so that we're ready to go when the vaccine arrives. Before I jump to flu season, I want to share one additional update. On Friday, we participated in a call with Secretary Cohen. She invited counties that have seen an increase in cases in the last 10 days, the top 1/3 of counties, so there are about 30 counties on the call, to participate in a call about what can we do next to help slow the spread in North Carolina. And really a piece of that that she was really interested in is, one, doing community education, which we're doing, making sure that we are participating in the wear, wait, wash, making sure that we're promoting that information. And we do that. We do interviews on the radio. We do TV interviews. We push this out to our business leaders, our stakeholders, our faith leaders. And so we want to keep doing that work and amp up the work that we're doing in that area. And we'll work with Ms. Sally Shutt and her team to make sure that we continue to promote those 3 Ws so that we can mitigate the spread. She's also asked us to explore opportunities to local ordinances that we might implement for guidelines so that we can have stronger enforcement of the executive orders. And so we are going to work with staff to explore that opportunity. So we'll have, we're waiting for additional guidance from the State Health Department on that, and we will share that once we have it. Okay, I'll jump to our flu season now. So of course, we have started our flu season, and the CDC says that there are 3 key actions to take. 1, we need everybody that's over the age of 6 months and older to get a flu vaccine every flu season. So if you got a flu vaccine in February, it is, even though it is still 2020, it is time to get another flu vaccine. And then also to practice our everyday preventive measures. So what we've seen in other countries that have an earlier flu season is doing the 3 Ws, wearing your face mask, washing your hands, practice social distancing also helps to protect you against the flu. So doing those everyday preventive actions is important. And then also to take antiviral medication if you do get sick with the flu and your doctor prescribes them. So we know that vaccination can not only help us to protect us against from getting the flu, but for those that do get sick, they are less likely to have severe illness and are less likely to be hospitalized. We also know that the same categories of people that are high risk for COVID are also the same individuals that are high risk for flu. And so it's really critical that we take protective measures to protect them. So I just want to, we get a lot of questions about flu and COVID, so I just want to run through this slide very quickly, and what's the difference between flu and COVID, and can you get both at the same time? So we know that both are respiratory illnesses, both are caused by viruses, although they're different, and they have similar symptoms. They both can cause fever, cough, shortness of breath. Some people have diarrhea and vomiting, some people have a runny nose, some people have a stuffy nose or a sore throat with the flu. So it's really challenging if somebody just has one symptom to say this is cold or this is a flu or this is COVID. So it's really critical that people get tested, and I know the State Health Department is working on some measures so that when people get tested for flu, they can also get tested for COVID at their provider. And that will help confirm the diagnosis. And then, of course, we know that COVID, because it's a respiratory illness and because flu is a respiratory illness, it is possible to have both at the same time. And if you do, what we anticipate is that will create more severe illness and put a strain on our hospital system. So we really want to avoid that. So what are we doing at the health department this year for flu? The last week in September, we received our supply of public vaccine and private vaccine. We typically get our flu vaccine later than the Walgreens or the Walmarts of the world. We get them later than our commercial pharmacies. But we got our flu vaccine the last week in September. This year, our flu season is going to be a little bit different. Because of COVID, the CDC, through the State Health Department, we are expecting to receive some additional doses of flu vaccine for uninsured adults. We already are able to provide flu vaccine for uninsured children through our Vaccines for Children program, but this opportunity will allow us to do that for uninsured adults through the state health department. We have not received those doses yet. We are waiting for an official memo and the green light to order that from the state health department. And as soon as we get that green light, we'll place our order and have that available. We did receive additional funding from the state health department to help with operational costs this year for flu vaccine. That funds staff time, supplies, equipment. It does not fund the cost of the vaccine, however. So that's still something that we'll have our additional doses from the state health department and from the CDC to help cover that cost. But our funding that we receive does not allow us to actually purchase any vaccine, but will cover additional staff that we might need. And one of the stipulations on that funding, of course, is that we do more outreach, make sure that we're vaccinating those that are high risk and those that are marginalized. So this year, how we're going to do it, we're going to have two options for flu. We will have flu vaccine at no out-of-pocket cost for both adults and children, and we're able to do that through the Vaccines for Children program and through these additional doses of flu, that we're going to receive from the state, regardless of insurance status. If an individual has insurance, we will bill it, but the individual will not have a copay, so they will be able to still receive that at no cost. So they'll have two options this year for flu vaccination, one in an outreach flu clinic. So we are working now to plan with our community partners to reach vulnerable populations with a flu shot. So we'll have a number of outreach flu clinics in the month of November where we will go off-site from the health department to make sure that those that are most vulnerable get a flu vaccine this year. It will either be through a drive-up, or if that's not possible, everybody doesn't have access to a vehicle, we will do it in person but socially distanced, and everybody will have to wear a mask. We anticipate having additional details about that on our website this week. The second option for people is to have it done at the health department. It will be by appointment only, again, because it gets crowded in our lobby. I was down there this morning, and everybody was socially distanced, but it was beginning to fill up as we enter into cold and flu season. So we want to make sure that we are able to remain distance in our lobby, and if we have walk-ins, we won't be able to do that. So people will need to call for an appointment, get an appointment, and then they'll be able to come get their flu shot for their family members. So the request today is to consider our proposed flu rate changes. So each year, Medicaid, the Centers for Medicaid and Medicare Services, sets a rate for flu vaccine. And we have several rates here that you can see. We offer Flu Zone, which is our high-dose vaccine, Flu Block, and our preservative flu for those that are age 36 months and up. You can see in the second and the third column here the Medicaid rate. Those have changed. The Flu Zone has, our current rate is $50. The CMS rate is now $61, so we're proposing an increase to $61 to match the Medicaid rate. The Flu Block is $45 currently, where the CMS rate is now $61, so we're proposing it to raise it to the CMS rate. And then the preservative-free flu vaccine is $19, and we're proposing to raise that to $20. And that is the reason for all of those is because CMS has raised their rates. But remember, we will be able to, this is just what we're going to bill insurance. If you're uninsured, we will still be able to do that at no cost for them. So last Friday, or 2 Fridays ago, our Board of Health approved the increase of the vaccination fees as presented to you and the waiver of the vaccination fees. So we're asking the same this evening for the commissioners to approve our increased flu vaccine that we will bill insurance and Medicaid, and the approval of the waiver of our vaccination fees, in particular for those that are uninsured. And I'm happy to entertain questions about flu and or COVID.
Okay, you want us to go ahead and do your motion first?
Yes, please.
Okay, do I hear a motion to approve those rate increases?
I move to approve the rate increases and the waiver of the vaccination
I have
fee.
a question on that.
Is there a second?
Second.
All right, it's been moved and seconded. Is there any discussion? Chief?
Real quick, basically what we're doing here, Dr. Green, is if you have insurance, insurance is going to pay for it anyway.
Yes.
So it's going to be a no cost.
Correct.
To the resident, to the citizen.
Correct.
Okay, I just wanted everybody to understand
Yes.
what was
correct.
going on there.
Yes, thank you for, yes.
Yes.
So if you have insurance, we will bill it, but you will not be, the citizen will not pay, but that allows us to maximize what we can get from the insurance company.
And if CMS is paying that, then we should
Yes.
be charging that. Okay.
Do you know off the top of your head if commercial insurance is paying a higher amount than CMS?
I do not know the answer to that off the top
I'm
of my
just
head.
curious. You don't need to know it, I'm just curious.
Typically, private insurance will pay more than CMS, but I don't know particular for those brands, but my best educated guess, based on what they pay for others, is that that is higher, because private insurance will pay more than Medicaid will.
Gotcha. Any other questions for Dr. Green on the motion? Or any other questions or discussion on the motion? If not, all in favor?
Unanimous.
Okay, thank you. This time, would you like to entertain questions now? Dr.?
Yes.
Okay, we'll have questions. Charles Evans.
Thank you, Mr. Chairman, and thank you, Dr. Green, for your presentation. The question that I have is, it was presented to me by someone else outside. Another citizen had presented this to me, and I just couldn't remember because it's been so long since this COVID has been going on. But the numbers that you're presenting to us, as far as the stats of the number of people that have been infected with the virus, those that have been hospitalized, all that, are those just the individuals that come to the health department, or do you get them from somewhere else, and where do you get them from?
Good question. So all providers and labs are required to report now by law, both their positives and their negatives to the health department, or to the state health department. So those numbers aren't just reflective of people seen by the health department or tested by the health department, but all providers in our community, and it's based on county of residence. So if you get tested in Moore County, but you live here, that case comes to us. So every provider is required to report, and lab.
Thank you.
You're welcome.
Mr. Booth?
Yeah, going back a couple of slides back, when you said the target, we were at 6%, you're shooting for 5%.
Correct,
And then-
for our case positivity rate.
Now, is there a chance that same people can be tested again, or if I'm tested in the first go-round, am I excluded from being tested again, whether I'm positive or negative, or can I just keep coming in because I'm thinking I've got it, even though you told me 10 days ago I don't? I can come back in again.
You can come back as many times as you'd like to. So these are duplicated numbers. So if you come back and you have 5 tests, you show up 5 times as in the denominator, but you only count as a positive 1 time. So if you test positive, well, let me preface that. So if you test positive and it is within 3 months of your original test date, we do not count you as a new case. If it's after the 3 months, we treat you as a new infection, so we'll tell you to isolate and quarantine again, but we don't tick you off as another case. We don't duplicate your case.
Okay, thank you. I'll be in at 10:30.
Mr. Keith?
Thank you. And Dr. Green, thank you again for coming, because this is an opportunity for, since we're on TV, people to hear from what you say. Got a couple things, and I know it must seem like you're trying to catch gnats with a butterfly net sometimes when all this is happening. But generally, I think all of us, 3 months ago, we may not have known anybody that's got COVID. That has changed. Most of us know people very close to us that have had it, so it is becoming more and more part of our life. But when someone gets this immunity, there's no other documentation yet. I know there's been some outliers where somebody may have gotten COVID again, but is there a time limit that they're finding that you become still immune to it?
So that's a good question. So that's the 3 months that we were talking about. So if you test positive 3 months ago and you test positive again within those 3 months, what the CDC and the state health department have said is we don't treat you like a new infection. So you don't have to isolate again, you don't have to quarantine again. We'll still do the contact tracing, but you don't have to isolate and quarantine again. If it's after that 3 months, we will treat you like a new infection. So for all intents and purposes, we're not counting you again as a second case, but you're brand new to us essentially. And so we don't think you have that level of protection that you did before. And
Okay, and if I can follow up, one of the things that I've heard a lot of people say now, and this is the difference between like an influenza and a flu, is your sense of taste and smell. Is that, I guess that's real, right?
yes, so loss of taste and smell is real and pretty unique to COVID. So that's, if you have loss of taste and smell and a runny nose, it's probably, I'd go get tested for COVID for sure, because that's not a symptom that we see often with the flu.
Okay, thank you very much.
Thank you.
Other questions for Dr. Green? Dr. Green, once again, thank you so much for
Thank
your
you.
presentation. It's very informative, very timely,
Thank you.
and continue your good work. Next item, Ms. Cannon.
Yes, sir. Item number 3 is your consent agenda.
Move to approve the consent agenda.
Second.
Okay, moved and seconded. Any discussion? All in favor?
Unanimous.
Next item.
Item number 4 begins your public hearings. We'll begin this evening with the uncontested rezoning cases. The first one is 4A, Case P 20-24. Mr. Howard.
Good evening, Commissioners. Ms. Cannon just stated this is case P20-24. This case is located, as you can see by the indicator map here, out in the more of the north eastern area of the Grays Creek area. So, in summary, just before I get into any kind of presentation, and unless you want me to open one up, the applicant and the owners, Rebecca Person on behalf of Francis N. Person, heirs, and Susan Strickland, the agent for this particular case is Yarborough, Winters, Neville, PA. The request originally when it came in was to go from RR, or the rural residential, to CP planned commercial. So just to let you guys know, when they came in first a couple months ago, CP is one of our most intense commercial districts. When it came in, you can see the location here is at the corner of Tom Starling, highlighted in the red hatch area you can see there, and then 87 is running in a north-south direction there. Sits right at the hard corner. When they came in a couple months ago, CP, according to our plans, was a little bit too intensive of a district. It allows pretty much the whole plethora, or like the range of commercial uses for the property. Staff at the time didn't support it because it wasn't plan compliant. We took that conversation to the planning board. The planning board then supported staff's recommendation. But during that conversation, it was put to the applicant, why don't you go back and tailor your request down a little bit more so it can be plan compliant? Which the applicant agreed to. We brought it back, we talked with staff. Then they changed the request from rural residential to CP commercial, and then CZ conditional zoning. So they essentially just split the property in two. So you can see what the request is now. The applicant agreed to that. Staff said it's more plan compliant now. They're going to C2P for the hard corner on the front, keeping the conditional zoning for the mini storage use on the back. So that also puts forth additional buffering around a lot of the residential uses that you see out there as well too. So staff thought it was a good plan. We recommended it. We took it to the planning board and they recommended it by a full vote. So unless you want me to open up a hearing, which I'll be happy to do, I'll be glad to take any questions.
Any questions for Rawls at this point? If not, I'll open the public hearing. Are the speakers, Madam Clerk?
There are no speakers.
Okay, I'll close the public hearing. Now, what is your pleasure? Can we get a motion? These motions have to be read, and they have to be exact, and we have to pick the right one.
Mr. Chairman, in case P 20-24, I move to approve the rezoning request from RR rural residential to CP plan commercial /CZ conditional zoning for mini warehousing with outside vehicle storage and C2P plan service and retail, and find the request consistent with the South Central Land Use Plan 2015, which designates these parcels for light commercial as use requested under conditional zoning, as well as conventional C2P district are considered light commercial uses. Approval of the request is reasonable in the public interest, as the conditional zoning portion will provide adequate buffering from the existing residential uses, and the conventional portion, which will cause the higher traffic impact, is located farther from the existing residential.
Is there a second? Second. Been moved and seconded. Any discussion? If not, all in favor?
Unanimous.
Okay, Mr. Howard, next case, please.
Thank you very much. Next case, Mr. Chairman, is case P20-30. Open this up real quick. This case also sits along Wilkes Road, out off of Wilmington Highway, out towards the airport. You can see by the star, it's also more or less in the southeastern area of the Fayetteville area. So the applicant and owner is Warren and Dawn Bishop. The agent is Patrick Bishop. The request originally came in, this is similar to the last case that you saw where it went to the planning board and got negotiated down to something that we thought was a good compromise. The original request was to go from MP planned industrial to A1, which is basically one of our larger lot single-family residential districts. You can see where the property is located here on the map. You can see the Wilmington Highway here, which sits along the eastern boundary of the tract, and then the western boundary touches MLK Jr. Freeway. So you can see it's kind of sandwiched in between there. The tract itself is about 44 acres. When staff first took a look at this, as you can probably tell, this is a heavily industrial area out by the airport. Some of the concerns that we had when we passed along comments to the FCEDC was the fact of trying to be able to mitigate not allowing a lot of single-family subdivisions going in around the airport in this area. This area's been identified as in the airport overlay, so it's impacted by that. At first, staff had recommended against it. We took it to the planning board. The planning board, through their discussion there, asked the applicant, really, what do you want to get out of this? And the applicant just stated, I just want to put a home out there. So when we took that back for discussion, we said, okay, well, what about if we take it to a conditional zoning just to allow one single-family dwelling, which is what the applicant did. He didn't have a problem with that. When we passed that to the FCEDC for their comments, they said they'd rather see one home out there than 50 homes out there. And so the request in staff's opinion as well doesn't change our land use plan, which is a good thing. So we move forward with that type of recommendation. So staff had recommended just the district for one home out there. The applicant was for it. When we took it to the planning board, they also supported it by a full vote as well of the board. So that's the reason it's on uncontested for this evening. So again, if you have any questions, I'll be happy to answer what I can.
Any questions for Mr. Howard this time?
I just have one question. So just to make sure, because A1 doesn't have to just be one single-family dwelling, but that's going to be the motion, that's what's going to be there for henceforth? I mean, I just kind of make sure once you rezone it, even though you say that, it could be used for A1, but it's conditional zoning, so is it just for?
Just for one home on the 44
no
acres.
matter what?
That's
On
right.
44 acres, one lot.
Yeah, so like the concern that staff had is that if we allow just a straight A1, then that would open it up
That's
for
right.
50 homes out there, and we just said that's really not what the plan calls for. I know the EDC was not a big fan of that, and the planning board wasn't a big fan of it. So with this conditional zoning, we're just one home. If you wanted to add more homes in the future, then they'd have to come back for a rezoning to do that.
Any other questions?
44 acres, one lot. You know who your neighbors
It's
are
a little,
going to be. You
yeah.
know who your neighbors are going to be.
It's a lot
Mr.
of land
Evans.
spread out.
Thank you, Mr. Chairman. So let me make sure I understand this. If we rezone this tonight, and you're saying that nobody else can come there and build any more homes, but what if later on, somebody decides that they want to build other homes there, and they will have to come back before us?
Correct. For a rezoning to
For
let
a
that
rezoning.
condition off. Yes, sir.
It still doesn't sound.
But they okay with it, but I mean, that's what they want.
The conditional zoning is what
Yeah,
is your,
the conditional
the trick here, right?
Yeah, because I mean, staff didn't want to change our plans because if it went to A1, it would put a residential land use plan designation out there, which would set a precedent for further homes out there if somebody were to come in the future. And we were trying to mitigate that to the best degree we could.
Okay, but the underlying zoning is still A1, is that correct?
Yes, sir.
But the condition is that you can only put one house there.
That's correct.
I got you. I understand. Okay. Any other questions for Mr. Howard? Okay, at this time, I'll open the public hearing. Are there speakers?
There are no speakers.
No speakers. We'll close the public hearing, and let's get the right motion on this one as well. Who has that motion?
In case P 20-30, I move to approve the rezoning request from MP Plan Industrial to A1 Agriculture conditional zoning for one single-family dwelling unit and find that the request consistent with the South Central Land Use Plan 2015, which designates this parcel for airport-oriented uses and open space. The airport-oriented uses designation is meant to protect the airport from unwanted encroachment, protect human life, and allow for further expansion. The site would be limited to a single-family dwelling unit and would be less density or people on the site than potential non-residential uses or a fully developed subdivision. Approval of the request is also reasonable and in the public interest as the intended use is in harmony with the existing zoning and uses to the south, and the site has access to public water.
Is there a second? Okay, moved and seconded. Any further discussion? All in favor?
Unanimous. Commissioner Evans?
Commissioner Evans, did you want to vote?
I'm voting against.
Okay, voting in favor, Commissioners Keefe, Chairman Faircloth, Commissioners Adams, Council, Booth, and Lancaster. Voting in opposition, Commissioner Evans.
Okay. Next case.
So we have a contested case on the agenda for this evening. Commissioners, case P20-44, so I will go through a full presentation for this one. This case is located in somewhat in the similar area. This is out by exit 44, if you guys are familiar with Claude Lee Road in that area that's off of I-95. It's pretty much right at the interchange. There's a little bit of moving parts for this one right now, so I just want to make sure you guys are reading this map correctly to make sure that you're not confused. The area that you see in the red crosshatch is a parcel. That's one full parcel. So I know it shows that you see a black line through here, but these are zoning boundaries, and the black lines, these are not parcel boundaries. So the request that you see from Heather Young Gorman and Robert, I'm sorry, let me go back. The request that you see from Heather Young Gorman and Robert Gordon, whose agent is Yarborough, Winters, and Neville, the request is to go from C3, heavy commercial, which is a dormant district, that's now CP, and rural residential, so it's split zone, to just fully rural residential. So, as I said before, the request is for this one parcel that's highlighted in the red crosshatch. You can see that it's split zone with this RR that sits on this little bit of the area right here, and then the rest of this is the commercial designation down here below. Is everybody clear on that before I move on?
I'm not. Because I'm looking at the rural residential, is that the white part, or is it outside of the red that's being rezoned?
How about this? I have a slide, 2 slides from now, that shows you in coloration what the zoning looks like, and that might clarify for you if I may, Commissioner.
That's correct.
All right. So, looking at the existing land uses around it, it definitely is a hodgepodge of vacant land. You have heavy industrial areas. You have a bar pit down here, cell tower, wrecker services. Elijah B. Place, you can see, is this road right here, is a dirt road that runs in this general direction off of Claude Lee. There's a home that sits right back here at the terminus, which you'll see on the photographs, which I'll show you here after just a little bit. But you can see pretty much this is the interchange of exit 44 off of I-95 out toward our industrial areas. This is getting to where you were talking about, Commissioner. So the tract itself is highlighted in the blue crosshatch that you see here. The RR is
Outside.
is this area right here. So this tract kind of spills over into RR, but the red is all the commercial designation. So this tract is split zone. You have RR on this little section here, and then you have commercial on the bottom 2/3 of it down here. Does that help you out?
Yes, so they own the whole parcel. Somewhere it got RR and for a couple of acres, for whatever number of acres, and the rest of it was, okay.
Yeah, so this tract in this area has come back in various iterations. I think it probably at least twice. I think last time it came back in the early 2000s, if I'm not mistaken. Before that, it was probably in the 90s. But also, I should also point out as well, too, the reason why you also have this little square right here is what you can probably see in the underlying photograph is this is a high transmission line power easement. You can kind of see the grass cut, the swath that's being cut through here that pretty much follows this square. And then goes, as you can see here, you can see how it kind of cuts through all of this and keeps on going across country, right? So you do have some massive utilities that are over there that kind of impact this particular piece of property. I wanted to point that out because that becomes important in the conversation a little bit later. When we look at the soils out there, they got good soils. There's no hydrics, so it's good for water. For well and septic. You can see where the PWC water and sewer lines, they're generally at the intersections, but they're across the exit. You can see where the water lines are here, and then there's sewer down here, but in the immediate area, you're not seeing a whole lot of it unless they start dragging those utility lines down their way. When we looked at the plans, and this became important for staff, all of this area was designated for heavy commercial, being the fact that it is a major exit off of an interstate. We had a case, I think, similar to this, like a month or two back, where somebody had gone commercial, and it was surrounded by commercial, and they had residential in the middle of it. It was a church, I believe, that was out actually off of 301. So it's a similar kind of case, the way staff looked at it. The plans call for it to be Commercial, RR is not a designation that's supported or in harmony with the area or out, for that particular interchange. When it went to the planning board, they had an alternative recommendation, which I'll get to toward the end of the presentation. So when you look at the subject property itself, this is, as you can see in the box down below in the lower right, there's Elijah B. Place. This is standing on the other side of Elijah B. looking at the track. There was a house here. It's pretty much demoed. This is not what this is pretty much what it looks like today. There's a garage storage building and a few little vehicles out there, but there's no structures out there currently. You can see the high tension wires that I showed you on the previous photograph bisecting somewhat the property running through it. This is as you're coming off of Claude Lee, you're looking at the end of Elijah B. Place. That's the house that was at the end of the cul-de-sac. If you guys recall at the first photograph that we showed, the property that's in question, you can see has the white sign that we posted out there on the left-hand side of the road. This is looking directly across the street from the subject property. As you're standing on the subject property, it's pretty much wooded. This is looking back, heading towards Claude Lee Road. You can see that the subject property is on the right, and you can see that we posted in accordance with state statutes. So staff had recommended denial of the request. When we went to the planning board offered up an alternative recommendation of R40 for single family by an 8-0 vote. I think there were some concerns about density for RR. As I said, RR allows 1 unit, I believe, per 20,000 square feet, which is 1 per half acre. I think that the planning board felt comfortable with 1 per acre, and that's all I have for that. So if you got any questions of me, you can. I know the applicant is here.
I just need to rewind that because that didn't make sense to me.
Yes, sir.
I really didn't make sense to me. Go back to, and I guess, I'm sorry, Mr. Chairman, but that just didn't make sense to me. So they denied the RR because,
They had concerns about the density.
and you can put how many on the RR?
You could put 1 per half acre.
Okay.
That's
And then
4.
on the R40,
You 1 per acre.
okay.
Yeah. I think it was in their mind, from what I
That's
ascertained
how-
from the conversation, it was a compromise for the applicant. So, yeah, so, I'm sorry.
Okay, thank you, Ross.
Yes, sir.
I can't wait to hear this one, because this is one of the strangest ones I've ever seen. It's not normally that someone wants to put residential in the middle of the highest commercial, pretty much, that we have. I don't think that sign probably had a lot of people passing by it to come out here. But it looks pretty landlocked, with right in the center of the commercial area. But the homeowner owns it now, correct? And owns
Yes.
the RR piece that's there?
Yes, sir.
Okay, and they're just trying to expand their RR?
It's my understanding, and the applicant will probably
Okay.
go into a little bit more detail, is I think they wish to build their home back on here, take it a little bit more off of the power easement. And so they had to get more land, and they're moving it off of the easement a little bit more. It's also my understanding, and the applicant can go into a little bit more, is I believe the ownership out here is pretty much all in certain family members. I think
Okay.
the family kind of owns all of this area on this street. But yeah, so I know the applicant's here with their attorney, who can probably speak in a little bit more specificity on that. And I know they have a handout that I believe staff should have passed out to you that shows photographs that'll be part of the applicant's discussion.
Okay, I want to get some clarity, as Commissioner Adams was talking about. Aside from the footprint of the homes, RR being basically 2 every acre, so they could put a total of 4 residences on this area. Is there any other conditions about RR allowing for mobile homes, allowing for stick-built homes, allowing for manufactured homes, or any of that other stuff that they can't get with R40?
It does allow for mobile homes and manufactured homes.
And what is the zoning on that one? Is it the same? RR will, but will, R40 will not?
No, it will not. That's only state.
R40 will not.
Correct.
But RR, they could put up to 4 mobile homes on there at RR.
They could put 2.
It's per every half acre. It's 2 acres, right?
Yeah, so yes, that's a good point. If they did 3, they would then be bumped up into a classification of a mobile home park, which would then
Okay,
go into a different discussion.
okay. All right, thank you.
Other questions? If not, I'll open the public hearing. Madam Clerk, you got one.
We have one speaker in favor, no speakers in opposition. Our one speaker in favor is Mr. Thomas Neville.
Okay, welcome, Mr. Neville.
Good evening. I've never had a zoning case where the commissioners said they were really waiting to hear from me. So it's kinda neat.
This is a unique one.
So again, I'm Thomas Neville, a local attorney here, office at 116 East Russell. And I represent my clients, Heather and Robert Gorman. They're both sitting here beside me. A little bit of background, just I've got a good bit to say in 15 minutes, so I'm kind of moving pretty quick. But this is family land. Heather inherited it from her grandmother. She or her family does own all the land with the exception of the land which is to the northwest, which is owned by the Riddles. Other than that, it is still her family or either uncles or her children or herself that owns the property. They also have an easement along Elijah Road for access. And I know that in 15 minutes.
You only got 3, but I don't know where you got the 15 from.
All right.
You only got 3 minutes.
So anyway,
He's got whatever I say.
This
he's
is
got.
simply an extension of their front yard case. And what happened was, my recollection is before planning board, no, RR was never denied. We presented the case as nothing more than it's our land. Both sides of the split zoning are ours. Our family, for the most part, surrounds the property. All we want to do is put our house on this land, and we want a bigger front yard. And as we presented it, the board then questioned essentially, well, if you're going to RR, that will allow you to put mobile homes here and put 2 mobile homes. And, you know, I honestly looked back at my clients and said, that's not what we're here for. We want to put our house here. So my client spoke up and said, that's all we want. We're fine with R40 if that's what you're asking us to do. In fact, they even said, we'll do a stick-built home, no problems with R40. So that's where the R40 came from. And maybe I should have presented it as R40 in the application to begin with. It just didn't occur to me. So that's the reason, or that's how we got from RR to R40. The house that's behind ours, the other RR, that's her brother's house. So moving a little more quickly. So I understand that the property is C3, but honestly, to think that this property has some commercial aspect to it it's not going to happen. The only way it could happen would be if my client sold the property for that use. I mean, it just is not going to occur. Maybe at one time that was, you know, the idea was that it would go commercial. There is a history of the property. It was rezoned to C3 in 1999. The split zoning back to RR occurred in 2009. There used to be a good number of salvage yards in this area, which was, again, my client's predecessors in interest. The surrounding property to our east would be, there is still a salvage yard there, owned by an uncle. The power lines, I believe, you know, would not allow for commercial applicability in that area. There is no sewer. There is no water at this time. It just is not a prime commercial property. What I really want you to see are the photos that have been in a packet. The pictures you saw presented by staff obviously are the current pictures. What you don't really appreciate is what's happened here. This was a salvage yard. The very first picture you have is what the property looked like until my clients began to work on it.
Wow.
Cleared every single junk car off the property, leveled the property, planted the grass seed. So now you have a pretty lot that you see on these pictures. That's what they've done. You know, we can only be so lucky as a county if everyone would do that to essentially what are eyesores. So they put a tremendous amount of sweat equity into this. It's their land, it's family land. All they really desire to do is to create essentially a larger lot or a larger yard. So for those reasons, you know, I would implore you to approve this. I know we're on the contested agenda. No one's contesting this. This is the best use of the property. It only impacts my clients and their family. It impacts no one else. So for those reasons, we'd ask that you approve the application for R40.
Okay, are there questions for the applicant at this time?
If I may,
Keith, yeah.
So, Mr. Neville, your client is good with R40?
Absolutely, they'll confirm it here
Okay,
tonight.
okay, thank you.
Any other questions for the applicant?
I don't need the applicant, I just need Rawls 1 second.
Okay.
Yes, sir.
I guess my question would be, what are we rezoning? So is the RR gonna stay RR and all we're rezoning is what's in the purple?
Good point.
I mean, what are we, so we still gonna have that RR out, because that's not a part of the rezoning case.
That's correct.
Okay, so you still got the RR. How big is that piece?
You know what? I don't know the answer to that question.
Is it 20,000 square feet, I guess is the relevant question.
My client thinks a half acre, right?
Half acre.
Yeah.
So the
Yeah,
easement
but
goes
that's a good
across here where the power line, okay.
Yeah, that's a good point. It sits smack dab in the middle of the easement.
Okay, I was just wondering, because go ahead.
I was going to make a motion for R40, but you bring up a very valid point here. Now we've got another split zoning on one piece of property.
But I understand it's under the easement, so I can do the R40. I was just trying to figure out, it just sits there. I was just trying to figure out what we were rezoning, and if that's enough for them to do it up under the R40, and they evidently said yes, so I'm fine with the R40. I just needed to make sure of what was going on. I mean, it's been split all this time.
But, Rawls, would it be better if the tracks were the same?
I mean, ideally, yes, I would say that would be the ideal situation, but I mean, I think that the point that you have that
You
is
wanna
sitting underneath the easement.
Go change that to R40 everything?
We're in favor of the ideal situation.
I mean, as far as being clean, if you want to see clean boundaries, yes, I would say that's the cleanest solution.
How many houses are on that track, or will be on that track?
Currently, right now, there's no house on the track. It was
None.
demolished,
Okay.
right? So they would be allowed to have one tract under one house under an R40 zoning for the parcel outlined in the blue that you see on the
Okay,
screen.
so the RR is just strictly
There
where
would
the
just be a
power line.
hanger out.
That's where the power lines are.
Correct.
So they couldn't do anything with that anymore.
All right, we'll go with R40.
You gonna do it or?
All right.
You got it?
Okay, at this time, I'll close the public hearing.
I'll make a
What is your
motion.
pleasure?
Mr. Chair, thank you. In case of P 2044, I move to deny the rezoning request from C3 heavy commercial and RR rural residential to RR rural residential. Instead, move to approve rezoning to R40 residential and find that the zoning request is an amendment to the adopted current Southern Central Land Use Plan map, and that the Board of Commissioners shall not require any additional request or application for amendment to said map for this request. The following change in conditions was considered in amending the zoning ordinance of the zoning map to meet the development needs of the community. The parcel meets the location criteria for R40 residential as defined in the Land Use Plan 2009, while the South Central Plan designates the parcel for heavy commercial. Much of the surrounding area that has zoned commercial has never been developed and would not have access to public water or sewer. And this rezoning approval, R40 residential, is reasonable in the public interest, as an R40 district is in harmony with the existing residential uses that have been developed in the area, and the access road is better suited for residential traffic as opposed to commercial usage.
Second.
Okay, moved and seconded. Any further discussion? All in favor?
That is unanimous.
Thank you, Mr. Howard.
Thank you, Commissioners.
Thank you.
Okay, at this time, there are no items of business for number 5, so we'll move to number 6, nominations. And the first nomination is Animal Services Board, and the chair recognizes Commissioner Keith.
Thank you. I recommend Mr. Jeffrey Brooks.
Okay, are there further nominations?
You got one over
Commissioner Booth.
Yeah, I'd recommend Teresa Blackwell.
Okay, are there further nominations? Okay, at this time, we'll close the nominations, and we'll move on to appointments. Mr. Vice Chairman.
Mr. Chairman, there's an equal number of nominees as to appointments. So for the Library Board of Trustees, Dennis Gedso, CEDZO, and Pamela Story to the Library Board of Trustees. Willie McCoy Jr. to the Mid-Carolina Aging Advisory Council in the volunteer category. And Charlotte Davis to the Animal Service Board in the at-large category. And Shannon Pingatory and Jennifer Castillo to the Animal Services Board in the City of Fayetteville Residents category.
Okay, is there a second?
Second.
Been moved and seconded to make those aforementioned appointments. Is there any discussion? If not, all in favor?
Unanimous.
Okay. And there's no closed session, is that
No,
correct?
sir.
Okay, this time I'm entertaining a motion to adjourn.
Move to adjourn.
Is there a second? Okay, all in favor?
Unanimous.
Meeting adjourned. Thank you very much.